Good morning, ladies and gentlemen. My name is Abdulaziz Nasser, Deputy Director, Middle East for Hong Kong Trade Development Council Regional Office in Dubai. To start, I would like to extend my sincere gratitude to all our guest speakers for joining and sharing their insights with us. Today's webinar is titled Building an Intelligent and Resilient Healthcare System for the Future. It is organized and hosted by the Hong Kong Trade Development Council in partnership with Dubai Healthcare City. The COVID-19 pandemic has created a strong demand for healthcare services around the world, resulting in huge challenges to health facilities. At the same time, the pandemic has raised awareness regarding the importance of building a resilient healthcare system and accelerating health-related technological development. At this webinar, we will take a closer look at the current healthcare situation in the Middle East and Africa, how the Hong Kong platform can help to facilitate health innovation, and how to capture the tremendous healthcare opportunities in the Guangdong-Hong Kong-Macao Greater Bay Area to ensure your business success. The webinar will take about an hour and 15 minutes and end at approximately 12:30 p.m. UAE time, 11:30 a.m. Saudi and East Africa time, and 10:30 a.m. South Africa time. It is conducted in English, and we will have a dedicated channel for simultaneous interpretation.
أيضاً قناة مخصصة.
So I just want to clarify this point. If you go at the bottom of the screen, you will find a circle and you will named interpretation. If you click the button, you will find English button and an Arabic button. So if you are interested to listen to the webinar in Arabic, simply click the button Arabic. Otherwise, you go to the English button and press English. So without further ado, please allow me to introduce our valued guest speakers. Our first speaker is Mr. Daniel Lam, HKTDC Regional Director for Middle East and Africa. Mr. Lam will start us off with the welcoming and introductory remarks and set the stage of the webinar. Our second speaker is Mr. Jaffar Bin Jaffar, Director, Property and Sales Operations, Asset Management, Dubai Healthcare City. Mr. Jaffar is responsible for leading the Dubai Healthcare City rapid growth and development and oversees its ongoing phase expansion. With his extensive managerial background, Mr. Jaffar has a wide range experience in operational turnarounds and upscaling, as well as outstanding relationship building skills. He will present to our audience about the current challenges for the Middle East and Africa health facilities under COVID-19. Our third speaker is Dr. Gitahinji Gitahi, Group CEO, Amref Health Africa. He is an experienced Group Chief Executive Officer with the medical and business qualifications with a demonstrated history of leadership role in multiple industries and more recently, specific focus in the healthcare industry. Skilled leader and management for profit, private sector and non-profit organization. Strong entrepreneurship skills, building and motivating teams and strategy development and results-driven execution. He's a senior leadership, 20 years work experience spanning through Avenue Group, Madison Insurance, GlaxoSmithKline, Nation Media Group, Smile Train International, and Amref Health Africa. Dr. Gitani will share about current challenges for Africa health facilities under COVID-19. Our fourth speaker is from Hong Kong. Dr. Ricky Chow, PhD, Chairman and CEO, Phase Scientific International Limited. As a Chairman and CEO, Dr. Ricky sets the vision and strategic direction of Phase Scientific and leads all of its fundraising efforts. As the lead inventor of the company's core technology, he founded Phase Scientific with goal of realizing the potential of the technology, which he developed while completing his PhD in bioengineering and at the University of California, Los Angeles. Dr. Ricky will share with us the successful story of health tech innovation using the Hong Kong platform and opportunities in Guangdong, Hong Kong, Macau, Greater Bay Area. And our fifth and final speaker is going to be Ms. Alice Tsang, Assistant Principal Economist, Greater China Team, Research at HKTDC. Ms. Tsang will introduce to us the smart healthcare development in mainland China and Hong Kong. And at the end of the speaker's sharing, we will have a Q&A session, and participants are welcome to direct questions to any of our speakers. So now, may I take this opportunity to welcome our first speaker, Mr. Lam. Please.
Thank you, Arvin. Distinguished guests, ladies and gentlemen, welcome to this webinar for sharing ideas and experience on building an intelligent and resilient healthcare system for the future. I would also like to thank Dubai Healthcare City Authority for the great support to this event. Today, we are glad to have several experts from the Middle East, Africa, and Hong Kong to speak about different important topics which cover the current challenges of health facilities in the region, the health innovation in Hong Kong, and new business opportunities in the Guangdong, Hong Kong, Macau, Greater Bay Area. Last but not least, the smart healthcare development on mainland China and Hong Kong. The current pandemic and the threat of future epidemics have challenged healthcare system in the whole world in several major areas, like the building of a more resilient and sustainable health system, the creation of new models for medical care, embracing digital innovations, and exploring new funding models. Another important development in this sector is the deployment of innovation and technology, with an active lookout for solutions to leverage existing sensors, smartphones, and wearable devices as contact tracking and health monitoring. Incentives are expected to grow and to make them more affordable. At the same time, hospitals and clinics are turning to wireless technologies to operate more efficiently, adopt new care models, and accelerate business transformation using digital infrastructure. Many market experts forecast that the demand of health or medical care related products and services in the Middle East and African region will be growing significantly and continuously in the coming decade. For example, the healthcare analytics market in the region is estimated to reach $1.8 billion by end of 2026 with a growth rate of 19%. The digital healthcare market will even surge at a compound annual growth rate of 28% during 2021 to 28. We at the Hong Kong Trade Development Council have long recognized the growing importance of the companies in this region as our major partners for business, trade, and investment. And we anticipate that ties will become closer still. The current pandemic brings the unprecedented challenges to the world in both social and economic aspects. However, new business opportunities, particularly the health and medical sectors, will emerge. And I strongly believe our companies in the Middle East and Africa can develop more partnerships with ours in Hong Kong and mainland China. In fact, Hong Kong has developed itself as an R&D hub for health innovations and is equipped with a world-class technology infrastructure for healthcare R&D. With a strong research capability, Hong Kong has established many top-notch universities and attract scientific research institutes from around the world. In addition, Hong Kong Science and Technology Park, the flagship technology center in Hong Kong, provides a wide range of facilities and services to support healthcare and biotech R&D. Moreover, being the key financial and capital market in Asia, Hong Kong has the potential to become the world's largest bio-IPO fundraising center within 5 to 10 years, which will strengthen Hong Kong as the leading funding hub for the biotech. Taking this opportunity, I would like to introduce a new important event in Hong Kong, the Asia Summit on Global Health, which is scheduled to be held on November 24 this year in Hong Kong. This important conference is jointly organized by the Hong Kong Special Administrative Region Government and the Hong Kong Trade Development Council. The summit is positioned as Asia's thought leadership event on health innovation and investment, as well as a one-stop cross-disciplinary platform to foster international collaboration on global health issues. Senior government officials, influential business leaders, investors, service providers, and renowned academia from around the world will exchange insights, explore opportunities, and collaborate on the diverse and dynamic healthcare sectors. In view of the pandemic, the summit will be organized in a hybrid format, which online streaming, virtual exhibitions, and business matching platform will be set up to facilitate the participation of investors, companies, and guests who cannot join in person. You are welcome to join this important summit. HKTDC's regional office in Dubai, together with our consultant offices in Riyadh, Nairobi, and Johannesburg, will be in close contact with you and offer any necessary assistance for your future business development. Thank you very much.
Thanks, Director Lam, for the insightful welcoming speech. We will come back to you later if our distinguished participants has any questions for you. Let us now proceed to our second speaker, Mr. Jaffar Bin Jaffar. Please.
Good morning and good afternoon to everyone in Asia, in Africa, and around the world. I'd like to take this opportunity to thank everybody, Director Daniel, the Hong Kong Trade and Development Commission, my esteemed counterparts, Dr. Hitahi, and everybody on the panel today. I would like to give you a brief introduction and insight to the Dubai Healthcare City and what the Dubai Healthcare City has to offer and what steps we've taken in the last 18 months to battle this, this pandemic. So if you allow me, I'm going to share my screen and let me know if you can see my screen. If the moderator can just confirm if you can see the presentation.
Yes, we can see it properly, sir.
Okay, excellent. So we're just going to give you a brief experience into the Dubai Healthcare City and how we support building an intelligent and resilient healthcare system for the future. Okay, so to begin with, on October 6th, His Highness Sheikh Mohammed bin Zayed, the Crown Prince of Abu Dhabi and the Deputy Supreme Commander of the UAE Armed Forces, delivered a message of hope, and he declared that the UAE had overcome the COVID-19 crisis, and it called for everybody in the country to return to normality. With more than 85% of the UAE's eligible population that have been vaccinated, infection rates have dropped significantly since June, hitting an 18-month low of approximately 156 new cases. As of this week, we are approximately below 100 new cases a day. Now, just to give you an insight on some of our numbers in the UAE for COVID-19, the total number of vaccine doses that have been administered are 20,475,211. The vaccination percentage of the population is at 95.5%, and the percentage of population that has been fully vaccinated is 85.2%. We've conducted over 86 to close to 87 million COVID tests. So that's approximately about 30,000 tests a day. And the number of diagnosed cases were 737,000, which approximates to about 111 per day. We've had a total of unfortunate deaths of 2,113 deaths. As of now, we don't have any new cases of deaths recorded. And the number of recoveries have been 731,000, as compared to the new cases of 191,000. So active cases that we have ongoing right now, that people are still going through treatment, are 4,450. Now, the current challenges for the Middle East and the health facilities on the COVID are knowledge and awareness, human capital and resources, new working models, and of course, global travel bans. This has been, I think, a challenge for all of us, where different countries have different regulations and requirements for travel, etc., as well as the airline companies or organizations. In response, we've worked very closely with the relevant health authorities to update our measures and to enhance our preparedness in responding to the requirements of this evolving situation. As a part of our response plan, we've eased certain requirements related to the work learning facilities in the Dubai Healthcare City. So healthcare professionals, including physicians, nurses, allied health professionals, were able to work in multiple facilities within the healthcare city without obtaining approvals that were previously required. So we eased the requirements that previously were in place. Being a part of the Dubai government, the Dubai Healthcare City contributed and by consolidating national engagement by launching a voluntary program for the public to take part in controlling this from stopping the virus from spreading. Among the business growth, so we'll talk a little bit, touch about the business growth. So despite the challenges of the pandemic, our performance was very positive. We've retained approximately 80% of our partners in the healthcare city. We've leased out approximately 70,000 new square feet of healthcare operators. We've had 33 new partners between 2020 and 2021. And our occupancy across the city is approximately about 91%. That totals approximately about 290 square footage of tenanted space. So the increase in lease space is a testament of our flexibility. We've made sure that we accommodated some of the international healthcare providers' demands and requirements, which previously were a little bit more stringent. And we've added the further ease of business support and setup, which which further enhanced was further enhanced by setting up easier licensing procedures and reduced inspections, so that our healthcare providers can actually concentrate on their business rather than figuring out how to run their business. So we've got an enabling ecosystem, being Dubai's foremost healthcare and wellness free zone. The Dubai Healthcare City is home to more than 400 international, regional, and local partners. And we anticipate an upswing in demand for medical tourism from international visitors, as well as the Emirates within the country. And we continue to reopen services with other countries. We are a healthcare community. We are an enabling healthcare community. One of our new facilities or initiatives is called C37. And the objective is to enhance the quality of healthcare services that are provided to individuals in Dubai and the UAE. So the Dubai Healthcare City launched C37, and this is the result of our commitment and efforts to strengthen Dubai's position as a healthcare destination and to enhance the capacity to attract top talent from around the world. C37 was established to facilitate access from doctors globally from Dubai and to overcome travel ban challenges that contributed to upending the travel greatly diminished by international patient care, by attracting overseas doctors or UAE-based physicians seeking independent or part-time practice. These efforts should positively impact the country's medical tourism sales, which are projected by the International Healthcare Research Center to reach
مركز دولي للأبحاث أن تصل إلى 8.4 مليار درهم، حوالي 2.3 مليار دولار هذا العام، وأن تنمو بمعدل نمو سنوي مركب قدره 17.1% على مدى السنوات الأربع القادمة. السوق واعد من حيث الفرص الاستثمار لكل من المنظورات التشغيلية والميزانية، ووفقا لتوقعات حديثة من المتوقع أن يرتفع الإنفاق الصحي بحلول عام 2028، وهو ما يمثل 3% من الناتج المحلي الإجمالي للبلاد. ووفقا للمجموعة الدولية للمراقبة في مدينة دبي الطبية تركز العديد من الابتكارات التي نراها الآن على مواجهة أكبر التحديات التي يواجهها قطاع الصحة، وهي المنافسة المتزايدة والتوقعات بارتفاعات أعداد المرضى. منذ مارس 2020 تقدم مستشفيات وعيادات مدينة دبي الطبية خدمة الرعاية الصحية عن بعد في أكثر من 70 تخصصا، بما في ذلك علم النفس والطب النفسي وجراحة العظام والطب الأسرة وطب الأطفال والطب الرياضي والأمراض الجلدية والتوليد وأمراض النساء والأورام. كما ذكرت لاحقا هناك العديد من التخصصات التي نقدمها من خلال هذه العيادات في مدينة دبي. تواصل الإمارات العربية المتحدة تعزيز مكانتها كمركز للرعاية الصحية في العالم العربي، ويواصل أرب هيلث المؤتمر الأول للرعاية الصحية في المنطقة والذي يعقد سنويا في دبي دوره كمحرر للأفراد والشركات والابتكار والتعاون. ومع انطلاق إكسبو 2020 قامت دولة الإمارات العربية المتحدة بتخصيص أسبوع خاص للصحة خلال معرض إكسبو 2020 للصحة، ورفع بدولة الإمارات العربية المتحدة، ويجتمع الخبراء هناك لمناقشة مستقبل الرعاية الصحية. وأشكركم على حسن الاستماع، وأتمنى أن أكون قد قدمت لكم نموذج مختصرا لمساهمة دبي في هذا الأمر. وأشكركم مرة أخرى، عودة إليكم مرة أخرى.
Invite our third guest speaker, Dr. Gatinji Gitahi, to start his presentation. Dr. Gitahi, the space is all yours.
Thank you very much, everyone, the distinguished panelists. If I could request Mr. Jaffar to stop the presentation, then I'll be able to share a few slides. I will be talking largely about resilience of health systems, and especially health systems in Africa. I want to make sure that I don't go over time, because this can be a very passionate topic because of those challenges that we find with the health system in Africa. So I hope I'll keep to my time. And let me start, let me share this. Yes. So I run Arm of Health Africa, which is the largest international health development organization based in Kenya, Nairobi. That's where we're headquartered. But we work in 35 countries in Africa. All the countries you see in yellow and green on this map. We are headquartered here in Nairobi, where I am based, where I'm calling you from, where I'm participating from. And all these other countries, largely in Sub-Saharan Africa, we have presence in all of them. But of course, we have other offices in Europe and North America for fundraising. And I look forward to our presence in the Middle East for fundraising as well. So I'll be talking to Jaffar to see how we can collaborate to establish a fundraising office in UAE. So this is where we are. We are present there. We run health services. We also run a flying doctor service that actually has been extremely useful in evacuating patients who have COVID-19 severe disease from across the continent, either into Nairobi, into Dubai, out of into Europe and the US. And we run a medical evacuation service, which is actually one of the most highly rated in the continent. And then we run a university, and we run an innovation wing. In the innovation wing, we look largely at how to use mobile technology to enable healthcare. So we are using mobile technology now for data collection from community health workers. I'll talk about that, from community level workers. We also use technology to train them, to train people who work at the community level, because these are not people who will take to classroom, they'll not go to the university. They are community members nominated by the community, and we work with them to enable them to do their work through technology. So that's who we are. We are a huge organization. We've been working since 1957. So I joined the organization 6 years ago. We reach about 12 million beneficiaries, and this year we'll probably spend about $150 million in health services in the continent. So we are a sizable organization, and we understand Africa because we work in Africa, we were born in Africa, and we've been in Africa all through. So the first thing I want to actually highlight here is health services in Africa, because as many of you as private sector, public sector, whoever you are participating in this conference, you're looking to understand also, where is the space for public sector? Where is the space for the private sector? How do we get to the level where, Jaffar has talked about in Dubai, and are there opportunities like there are in Dubai? Where is Africa, as it were, on health? The first thing to say, and I'm going to reflect on this a little later, is that the African healthcare sector is underfunded by government. The government spends maybe about, on average, you can just put an average of $50 per person. Compare that with 4,000 in Europe, and I'll show you how it looks for Dubai in my calculations from World Bank data. But just to show you that it is the public financing of healthcare is very low, and we'll say why. The next thing is that because of that gap, the people themselves, the household, the individuals, have to get out of their pocket to seek healthcare. So a lot of people, for example, will go for medical tourism in Dubai or in India or in China or wherever else they go, are actually doing so out of their pocket, not government finance. The next thing is that because of that, 30% of them don't seek care. So people who are unwell will just wait because they don't have the money to actually support their healthcare services, and it's a major cause of poverty. It's estimated in a country like Kenya, where I live, about 1.5 million people fall into poverty every year because of health costs. So it's a big concern. The next thing is to look at a low level of quality of services. Because of this challenge, diseases like non-communicable diseases are the least covered. Number one, they are expensive. They are not supported by donor money, so they are actually largely the contributors of this out-of-pocket expenditure of 30%. And therefore, people with hypertension, diabetes will live for long without bothering to go get checked, or they'll fall out of medication because no one is supporting them. They have to support that out of their pocket. There are, of course, efforts in some countries to create a national health insurance service, but that is far and wide in the continent. The next thing is that access to surgery is also limited, so people will leave. I worked with a cleft organization. These people are born, children who are born with cleft lip or cleft palate. I worked with them for 7 years. It's called the Smile Train organization. And we found thousands and thousands of people, not children, including people who are 70 years old, who have lived with a clefted lip. And they have lived so in their community because they couldn't afford to go and seek surgery. Luckily, we are providing this for free, but you can imagine for someone to live with a visible illness on their lip for years, for their life, that tells you the problem of access. Because if they knew they could afford it, they would have been fixed because it's visible. Leave alone, disease that we can hide, swelling on your back and this kind of thing. And of course, there's a problem with family planning services, which I'll talk about in a minute. So generally, there is low population coverage of health insurance. People live far from health facilities, and those gaps are kind of filled by small private sector providers. It could be nurses, it could be clinic officers who start small private clinics near where people live because the public center may be too far. And we only have 3% of the global health workers, as you know, despite the fact that Africa has about 24% of the global disease burden, but we only carry about 3% of health workers. This is a challenge that is important to understand. It's a macro issue. And this macro issue, if you look at the world and you map each country by size of its economy or its GDP, Africa would be this tiny dot here in terms of the GDP, because it accounts for only 2.7% of the global GDP. But when you look at population, Africa is a big contributor. It is actually 17% of the global population. And what results from this? What results into this? The result of this is this, that when you look at Africa's GDP, and then you compare that with Dubai, you compare that with the Netherlands. I've picked these figures from World Bank data. So Jaffar, if they're wrong, you can feel free to correct me. I've picked them straight out of World Bank data. So if you look at this and you compare the GDP of Netherlands and Dubai and sub-Saharan Africa, I've left out North Africa. And then you say, you allow the government to collect taxes, 25% of this GDP as taxes. So in Dubai, you collect $1.5 billion. You collect $4.5 billion in sub-Saharan Africa, 213. And then you allocate part of that tax collection to health, about 15% of it. When you divide what you get by the population of each of these regions, you end up with this per capita public allocation to health. You end up with almost $4,700 per person in Dubai. You end up with almost $2,000. You end up with $64 in Africa. And this is assuming that this 25% is equal in all regions, which it is not, because the Africa figure here is 14%, and the allocation to health is 7%. So you can actually divide this by 4 and you'll end up with less than $20 per person of what is actually happening. So the average, when you look at all countries, if you are to add the northern countries, North Africa, then you'd end up at about $35. That's what the government generally would allocate out of its own money to health. That, of course, has to tell you that the government needs to increase the money, but there is a problem with the economy to increase the money. Therefore, the question is more of efficiency. How do we use innovation, technology, to allow the government to be more efficient on its money, because we don't have adequate money? $64 at the best allocation is peanuts. Now, so who is paying then for healthcare? Because you can tell from the government coffers, from taxes, we can't raise enough money. So who is paying? If you look at Netherlands, just a similar comparison, the government is paying 65% of healthcare, Dubai 51%, Sub-Saharan Africa is about 36%. So who is paying the balance? The balance is being paid by people out of pocket, as I said earlier. People are paying 33% of healthcare costs, while in Dubai it's only 13%, and in Netherlands only 11%. I'm raising this because it's important for private sector to understand that when you come into the continent, then who is going to pay for the services that you're going to put in place? And those services are going to be paid equally between the government and the people themselves. Therefore, you must look at a model that actually brings together these two, people paying out of their pockets and the government. You can't depend on insurance wholly. The other number I want to present to you is that this out-of-pocket expenditure, based on the per capita income of individuals, which is $43,000 in Dubai and $2,000 in the Netherlands, and $1,483 in Africa, the out-of-pocket expenditure that an individual spends in Africa is 3.5% of their total income. So it is a significant cost, and many people don't even spend it because it's too much and they can't afford it. So I will skip that because that's just an example of Kenya and how Kenya particularly spends. But I want to draw your attention to the fact that private insurance contributes only 6% of the expenditure on the health sector. So the impact of this is a fragile health system, which has been battered by COVID-19, and therefore, no measure of lockdowns would have allowed the health sector to be protected. Sub-Saharan Africa has minimal investment in doctors and nurses, ICUs, ventilators. You can see here is blank. When you look at North Africa and South Africa, at least there is some activity there. And you look at the rest of the world, you can see what's going on. So there is a very weak health system, which results in the fact that if you're sick of COVID-19 in Africa, critically ill, you're more likely to die. That was a study that was done. And you can see also we have very low private vaccination rate. In low-income countries, only 3.76% of all booked vaccines are booked by low-income countries, while 342% of their populations in high-income countries have been covered, meaning that they have covered multiple times their population, while low-income countries cannot even achieve 4% bookings. And of course, everyone knows the situation of COVID in Africa. So I want to just highlight as I close that this is how the health sector is arranged. You have the community health workers who are unpaid. They work at the lowest level. And then as you go up, you have, of course, the district hospitals, referral, and the level 6 hospitals. These health workers are all paid. The lowest ones are not paid. And as you go up, the private sector participation increases. So private sector participation is minimal at the lower levels, or very local. It's a nurse, a clinic officer, but participation of private sector like yourselves will be more increased as you go to level 4, level 5, and level 6 hospitals. And indeed, let me see. Yeah, indeed, that's what I wanted to share, but also share that there was a study that was done. You can see this at this particular link, where you looked at different areas of healthcare, including innovation, and there was a rating. I was part of this advisory team. It was looking at 18 countries in Africa, and this is what came out in terms of access to innovation, advancement, access and application of technology. So if you have a new technology, which country is more likely to actually accept it and adopt it? And you see rating, South Africa was highest, followed by Rwanda, Ethiopia, and then you can see the listing, and you can actually look at what features were looked at at this link of futureproofinghealthcare.com. There's an index for Africa. So as I close, the role of private sector then is direct service delivery, but you have to see that the money will come from some insurance, but people paying for themselves, not government. Secondly, in the public sector, we have seen incidences of contracting for services. Government has started to go in PPPs, into private-public partnerships. And we have seen one major one in Kenya, which is called the Managed Equipment Service, which is worth almost, I would say $70 million every year for 7 years. But they are getting into other PPPs. Then training of health workers is big, demand-driven, individuals paying for themselves. But most of these people will work in Europe, in Middle East, they'll work in America. So largely nurses will then relocate. And then finally, developing technology and innovation. So I would like to stop there, and then I'm sure there will be a chance for me to answer any questions that the audience may have. Thank you very much.
Thank you, Dr. Gitahi, for your inspiring presentation that will help us understand the healthcare companies with their future businesses if they are planning to go to Africa. Our fourth speaker is Dr. Ricky Chow. You may start your sharing us your experience of health tech innovation using Hong Kong platform. Dr. Ricky, please.
Hi, everyone. This is Ricky Chu, founder and CEO of Face Scientific, which are based in Hong Kong. Thank you for the organizers for the invitation to share our story and experience during the pandemic and utilizing the platform and opportunities that we have in Hong Kong and the Greater Bay Area to really advance our company and also allowing us to spread our core technologies to contribute to the fight against the pandemic. So please allow me to share my screen here. All right. So about my company, I found this company, we are a very young company, and we started this company back in 2015. And the core technology of this company was based on my PhD thesis when I was doing that at the Department of Bioengineering at UCLA. And in the beginning, I started my entrepreneurial journey at Southern California, where we were able to get some support from a different department from the US government, as well as the Gates Foundation, particularly focusing on developing rapid diagnostics for infectious disease, especially in resource-poor setting. And one of the major projects that we were funded by the Gates Foundation is actually to develop a saliva-based rapid diagnostic for malaria and to be deployed in places in Africa. But at the same time, I decided to set up the headquarters of my company in 2018 to be set up in Hong Kong. And as you would find out by the end of my presentation, that this is one of the best decisions that I have made for my company. And you would find that this story that I'm about to share is a story of doing things at the right place at the right time. But I think the key is about at the right place. Okay. For us, when we moved to Hong Kong, we actually pivot our core technologies into focusing on cancer diagnostics. And we have been pretty successful, and we have been working with the top-notch professors and hospitals throughout the world to demonstrate our technologies in enhancing diagnostic. What our core technology can really do is, I'm not going to go into detail in this presentation here, but the fact is that our core technology allow us to make many different diagnostic tools to be more accurate, to be cheaper, to be faster, and to be more accessible. Now, during the COVID pandemic, we are very lucky to be positioned in Hong Kong, which allow us to capture the support simultaneously from 3 different governments. We are able to get support from the Chinese government, from the Hong Kong government, as well as the US government to develop a variety of COVID diagnostic for different countries. Now, but the story of us really start in last year's February, when I got a phone call from a professor from the Beijing University, who back then have, at that time, China have a serious outbreak, and everybody is scrambling to develop diagnostic, especially the PCR test for COVID-19. And at that point, when the professor called me up, he understands my technology and he is telling me that, hey, everybody is trying to develop the PCR test kit. However, the sensitivity, the accuracy of the test is being questionable. And understanding the core technology that we possess, he is inviting my team to develop technologies and products that can actually help with the pandemic. So what happened back at that point is then my team in Hong Kong, together with the team in California, has been working around the clock in the next 3 weeks to really develop the technologies using our technologies, using our core technologies. And what happens, fast forwarding in 6 months, is we have developed an entire workflow covering the sample collections, the RNA extraction, as well as the PCR reagent. And each one of them are able to get tremendous support from the local governments, and also working with the top experts in the local area. And as you know, in Hong Kong, we really have the top-notch academia and healthcare professionals, which allowing us as a startup back in 2020, able to work with some of these top-notch experts to really accelerate the development. Some numbers back then is that in before COVID, right, before 2020, we have around 30 staff in Hong Kong, and globally around 50 staff. To date, we are close to 300 staff globally, and 300 and 250 of them are in Hong Kong and the Greater Bay Area. So as I mentioned, after the 3 weeks of no non-sleeping days and nights, we're able to develop our technologies. However, at that time, in Hong Kong, we have less than 100 confirmed cases. And as you know, as a startup, as a small company, whenever you have a kit that will develop, you need to perform clinical study. And very lucky for us, because with the relationship with the Chinese government, they are able to provide us a special permit to enter into the Wuhan Jinintan Hospital, which is at that time the ground zero of the COVID cases. And during this clinical studies, where we compare our technology that we developed in 3 weeks with the national gold standard, and we found that in that study, there are 20 patients that are enrolled in the hospitals. We don't know if they got COVID or not yet. And we separate the sample in half. One half go through the national gold standard, the other half go through our technologies. And out of that result, we found that the national gold standard discovered 5 confirmed cases of COVID. And using our technology, we found out we've discovered 7 confirmed cases. And the extra 2 confirmed cases were later on confirmed to be really true positive cases for COVID. And because of that, the Chinese government has needs our company and our core technology to be an important technology, and also giving us resources to further develop our products. And once we are able to get into that stages, we are working very closely with the Hong Kong government. As I mentioned, in the following 6 months, we're able to develop a series of COVID products, and by direct communication with the Hong Kong government, we're recognizing that the shortage in Hong Kong is really about the PCR services, because that is the gold standard. Everybody wants to increase the testing capacity in Hong Kong, and we are allowed to build our COVID lab in Hong Kong in record-breaking speed. Within 1 month, we have able to build a COVID-19 lab in Hong Kong. But unlike many contractors in Hong Kong that are Chinese-based, that already have 10, 20, 30 years of experience in lab services, we are the only lab contractor in Hong Kong that are based on technology that are developed locally, as well as manufactured locally. And we grow very rapidly by working directly with the Hong Kong government, and the government has given us a lot of opportunity because they are recognizing innovative developments and giving a startup like us a true opportunity during the pandemic to contribute. And this is something that we are extremely grateful. And I can be certainly telling you that if I stay put in California, and yes, we can still develop a lot of this product because of our R&D capacity, but the fact that we are able to immediately put our efforts into the community and do all these services, I don't think this is really possible. And And this really allowed us to gain a lot of insights, because not only that we can develop new product based on technology, by actually working with the government and actually interfacing with the citizens on the street level, that we on the ground level, then we are able to further fine-tune our products, our workflows, our technologies and products, which allow us to really not only from the developer point of view, but also from the user point of view, to perfect our products. And I think this is the main reason that when we developed our rapid antigen test, and as many people know, this is a very simple test that can get result within 20 minutes. The cost is, less than $10 US. In fact, in many places it's trading around $2 to $5 US a piece, which I believe could be, affordable in many developing countries. However, these tests' major problem is accuracy. Okay, it's accuracy and how we can massively deploy that, to the market. And because the fact that we are in Hong Kong and we are able to work with the local governments, we possess the world's largest clinical study, where we have over 20,000 data points, where we are collecting samples with the local citizens in Hong Kong and validating each samples with the gold standard PCR test. And I think that is the major reason which allow us to get the first and only US FDA emergency use authorization to be also sell in the US. And this really allowed us to build our reputation from a startup for a small business that we have, and really jumpstart into the global market arena. And currently, we are able to produce locally in Hong Kong around 10 million kits per month. However, and I think this is where the Greater Bay area in China that comes in, that we are right now looking into increasing our capacity tenfold into around the range of 100 million kits per month. And honestly, in Hong Kong, this is in no way that we're able to do that. But by combining the large production capacity that there is in China, in fact, our manufacturing plant in Shenzhen is now up and running. We think in the next few weeks we're able to hit 20-30 million kits per month. And that allow us not only to sell them into the rich country, which have of course have a higher margin, but also start contributing to places in the MEA region. In particular, for example, and I think because of the fact that COVID, as we all know now, would become like a flu-like situation that would come, and we need to learn to live with them. I think the rapid antigen test is something that would become a very commodity type product, but everybody, just like masks, would have to rely on. And now what we have able to achieve is through this opportunity that we have in Hong Kong and the Greater Bay area in China, that we're able to validate our product using our innovation to enhance this product so that the sensitivity and accuracy of that is one of the top-notch products globally that allow us to get the FDA approval. And at the same time, because of the large production capacity, that allow us to contribute to many different regions. For example, in 2 weeks, the Hong Kong is going to have the first big sport event, which is the Hong Kong Marathon, and we are able to provide all runners 2 tests of rapid tests to test before and after the event, to ensuring that the event does not cause outbreaks. And we are also getting our product into many different regions in the Southeast Asia country. A month ago, we also get the emergency use authorization in Kenya, which to our understanding is the first product that I get into the region. And I think our price is very affordable, which we hope that we can further expand our reach into the African market. And I think this is exactly the reason why we need a collaboration here, is that, as you know, that we are able to reach out to the region of the common markets, because where there are a lot of agents, there are a lot of sales, there are a lot of distributors to help distribute our product. But for places in Middle East and in Africa, we absolutely would look for business partnerships to help get our product into the region, because, well, as you know, the first hurdles of getting any product into any country is the regulations of the local government. And we absolutely require the local distributors and business partners to help us go through the hurdles so that I think top-notch product like what we are developing here have the chance to help the local countries. All right, and I'll stop here and thank you very much.
Thank you, Dr. Ricky. Our final speaker, Ms. Alice Tsang, will talk about smart healthcare development in China and Hong Kong. Ms. Tsang, the space is all yours.
Hello, thank you. Can everyone hear me well?
Yes, yes,
Okay.
We can hear you properly.
That's good. Good day, everyone. This is Alice from Hong Kong Trade Development Council, and I'm from the research area based in Hong Kong. And today I'm going to share with you the smart healthcare development in mainland China and in Hong Kong. And I'm very impressive about like Dr. Chiu's experience in using Hong Kong as a platform to tapping into different markets. And today I'm also going to show you like why Hong Kong is a successful or is an ideal platform for medical or healthcare equipment to companies to explore other markets over the world. So let me share with you some macro data. And in the global market, it is forecast that in the year 2030, the global medical devices sales will reach about like $800 billion. And this is a very conservative estimation. And because we can see why, after the COVID pandemic, there is a latest technology development in the healthcare industry, not only for traditional medical devices, but also the innovative and new medical wearable devices, as well as some VR and AR technology to use in diagnostic practice. And of course, in Hong Kong, there are some R&D companies using robotics in surgery or rehabilitations to help patients to recover properly. So we can see that in Hong Kong, not only medical devices, but also medical technologies is also booming very fast. And in mainland China, the world manufacturing base, and actually there are more companies involving in high-tech medical devices industry. And we can see that in year 2019, the number of companies involved in the medical devices industry actually increased by 37%. In 2020, it reached the number of 5,588 companies in mainland China, which is focusing on medical devices market. And besides, with the population of over 1.4 billion, mainland China is also facing a problem of aging populations, which will increase the healthcare protection in the near future. And right now, there are about 190 million people in China are over 65 years of age, which is accounted for more than 13% of the total populations. And we can see the demand for digital healthcare will grow significantly. It is because after the pandemic, many people have switched to using telemedic consultation rather than visiting the doctor physically when it is available. And then we can see the number of companies in the digital healthcare market actually is increasing very dramatically. And for example, the Guangdong-Hong Health and WeDoctor also have a significant boom in their number of patients after the pandemic. And according to the chart in this PowerPoint, it is estimated that the digital healthcare industry in China will reach about to $611 billion by year 2030. So we can see that in mainland China, both medical devices and digital healthcare services are also in a significant demand in the near future. So back into the Hong Kong market, and as you all know, Hong Kong is an international logistic hub, and we are an important trading platform between mainland China and the rest of the world. And actually, in the first half of this year, Hong Kong import $9 billion of medical and healthcare devices. And these imported products are mainly from Chinese mainland, followed by the European Union regions, and USA is ranked at the third. However, we also export about 80% of our import to different parts of the world. And you can see that Chinese mainland market also is our largest market, which accounted for 24% of our total healthcare devices export, but followed by the EU and the USA. But from the pie chart, you can see that we export healthcare devices market to other areas or other regions over the world is significantly higher, is around 27%, which is higher than our single largest exporting countries, Chinese mainland. And in last year, according to Hong Kong and Statistics Census Department, we only have 160 medical and healthcare manufacturing companies in Hong Kong. It is because in Hong Kong, our production cost is very high labor costs and high in rental costs. So therefore, many companies in Hong Kong are focusing on healthcare R&D, and they use across the border mainland China to do the manufacturing, same as the case as Dr. Chiu just shared. And in Hong Kong, we do have some manufacturing companies in healthcare devices, but if you want to expand your company scales in large, mainland China's production base is the ideal place for tapping into the market. And right now, Hong Kong have 1,400 companies involved in the import and export trade for medical and healthcare devices or services. So therefore, although we are in small place in scale, but we have a lot of prominent companies and many traders are involving into the healthcare and medical devices trade. Why we are so good at that? Because Hong Kong is a international logistic hub, and we also have a high quality of exporting many temperature controlled drugs and vaccines. For example, in year 2018, Hong Kong International Airport already got the IATA certification for the Center of Excellence for Independent Validators in Pharmaceuticals, which means that all the products or all the drugs or all the vaccines which had to be in medical control and in temperature controlled, Hong Kong Airport is have the ability to handle these pharmaceutical products in a stringent control process. And also, Hong Kong has a lot of international accreditation centers such as SGS, which is a world's leading inspection verification company. And many of our storage in Hong Kong is certified by these international certification companies for storage for pharmaceuticals product. So therefore, actually, many vaccines or drugs which are using Hong Kong International Airport to be the distribution center for their products to go to ship to other countries. So as well as we are also, Hong Kong is the part of the Greater Bay Area, which I would like to explain a little bit about the GBA area, which is consists of 9 mainland cities in China, and also Hong Kong and Macau SAR government. So totally, there are 11 cities in the GBA area, and Hong Kong has a close relationship with technology development with Shenzhen, which is just across the border. And currently, Hong Kong government and the Shenzhen municipality government is developing the Hong Kong Shenzhen Innovation Technology Park at the Kong-Macao Loop area. And this area will be designated for healthcare and technologies as a priority. And just in the policy address, actually, which announced early October, Hong Kong and Shenzhen will develop the Kong-Macao area and the Santin area as techno notch in Hong Kong to develop IT and healthcare technology industries. And currently in the GBA, some of our Hong Kong registered drugs and medical devices are allowed to use in the public hospital in the selected hospital in the GBA. And these imported drugs and medical devices are not registered in mainland China, but still they have allowed to register in Hong Kong. They are allowed to use like in selected hospital. So that's why Hong Kong healthcare development is closely developed with the Shenzhen and the mainland GBA cities. And right now, for clinical trials, some of the public hospital in Hong Kong and private hospital in Hong Kong are allowed to use their clinical trials results to apply National Medical Product Administration certification in the mainland China. So therefore, Hong Kong can be a good like clinical trials platform for international drugs which are interested to tap into the mainland market. And also, Hong Kong is developing their own our own innovation hub for R&D. And for example, as Daniel just mentioned, that the Hong Kong Science and Technology Parks in Hong Kong provide excellent facilities for like biomedical technology supporting center and other like facilities to help Hong Kong to incubate their own R&D development in health industries. And a prominent case is the Health at Inno Hong Kong, which are supported by the Hong Kong government, which has right now have received already 60 applications from university and research institutions worldwide. And among them, more than 20 of these R&D centers have already completed renovations, and they are starting to do the operation progressively. And other Hong Kong government supporting the development of R&D is the government has launched a 5-year global STEM professorship scheme, which is to encourage outstanding overseas scientific researchers and their teams to set up labs in Hong Kong to carry out their research project. And here are some like facilities in Hong Kong and Science Technology Park to support healthcare and biotech R&D in Hong Kong. So for example, like the MIT and the Stanford University and the Sweden University also have set up their research center in the Hong Kong and Science Technology Park. So therefore, actually, Hong Kong is looking for like global research collaborations worldwide to help and facilitate medical R&D. So besides talents and technology, monetary fundraising is also an important part of technology development. And in fact, the Hong Kong Exchange has launched a new listing regime in year 2018, and allowing that pre-revenue biotechnologies companies to raise capital in Hong Kong. Therefore, Hong Kong has become Asia's largest and the world's second largest biotech fundraising hub. And as of the mid of this year, Hong Kong has 67 new healthcare listing and raised 209 billion Hong Kong dollars in Hong Kong, and these include 33 pre-revenue biotech companies. And of course, because of the close connections between Hong Kong and China, some of the pre-profit biotech companies which met certain requirements, they can allow to trade in the stock market between mainland China and Hong Kong to raise more funds while these two markets. So in general, Hong Kong is an ideal platform for smart healthcare development because we have a strong government and institutional support. And Hong Kong University graduates are well trained, and there are many international talents available in Hong Kong, because like Hong Kong is international cities. So people from abroad actually can live and adapt to the Hong Kong environment very easily. And then with the proximity of the geographic proximity of GBA manufacturing production base, so many medical companies actually incorporate with their headquarters in Hong Kong and have their production base in the mainland GBA area for cost effective and lowering their costs, manufacturing costs overall. And Hong Kong is strong in IP, so therefore once you have your medicine or drugs or medical devices registered in Hong Kong, so they will give you like a full protection and don't worry about like the plagiarism or other copyright issues. And last but not least, like Hong Kong is an international business network. Many of the overseas visitors, like before COVID, not COVID because we close our border right now, can come to Hong Kong without visa. So that's why it is an ideal platform for mainland companies and overseas companies to meet at Hong Kong to discuss or have seek to their business development. So I would like to share and recap some of our Daniel have said before about our Asia Global Health Summit, which will be held in November 24th. And this summit is actually organized by Hong Kong government and Trade Development Council. And this event will be in a hybrid approach. So you can also participate while online. And we have confirmed more than 50 speakers. For example, the Hong Kong Chief Executive, Ms. Carrie Lam, will have the opening remarks. And also former Director General of the World Health Organization, Dr. Margaret Chan, also will be one of our speakers in the event. So therefore, we have a lot of like well-known and like international healthcare professionals will be participating in this event. So if you are interested, please welcome to register online. And here is the exclusive delegate digital pass, which is listed on the PowerPoint. And if you have any questions about the registration, I believe like our Dubai office and our headquarter colleagues will help you to register just in case. So here is the website, and in case you have any questions, please feel free to email or like visit the website for the more details. And here is the end of my presentation, and thank you.
Thank you. Thank you, Alice, for this insightful presentation. We hope that this information will help our audience to understand more about the healthcare industry in the Middle East, Africa, and in China. We will now move on to the Q&A session. So if any of the audience has any question, please, you can type it on the Q&A. We will try to answer it now, or we will answer it after we will get the answer from the speaker after the event and share you with the answer. Let me now start by asking a question to Mr. Jaffar Bin Jaffar. Mr. Jaffar, what initiatives Dubai government is taking to encourage companies in health sector to do business in Dubai?
So there are several initiatives that are being looked at. The ease of doing business has become a lot quicker. The requirements for paperwork, the costs of setting up a business have been reduced by 30% across the board. And Dubai is also looking at, or we've looking at partnering with other on large-scale projects, on PPP projects, private-public partnerships as well.
Thank you, Dr. Jaffar. Another question is for Dr. Gitahi. Dr. Gitahi, Africa is very promising market for companies in healthcare sector. Can you give us 3 advantages of entering the African market And what is the best country to start from?
That's a very difficult question to select a best country out of more than 50 member states. I think the first thing to say is that Africa has probably the fastest growing population. So right now, Africa as a continent has about 1.3 billion people. That's a huge market. And by 2050, it's going to have 2.5 billion people. It's going to be a third of the global population. Now, this development is going to be accompanied by the increasing demand of African countries to create Africa as a common market. And this is the Africa Continental Free Trade Area, which is going to increase the flow of people between countries and the flow of goods, and also remove tax and non-tax tariffs that barriers that actually hold back trade. So already the Africa Continental Free Trade Area ratification has started. We have also, as a final point, now started to discuss having a common medicines regulatory agency across the continent, and countries have also ratified this, which means that any products that you have in one country will be able to flow easily to another country because we'll have a common regulatory framework. So this is all important. As to where to start, that is difficult. I think every single country in Africa have shown it depends on where you want to start. If you're looking at innovation adoption, I've shown you a list of the countries that are adopting technology faster. If it's product, then we may need to look at the countries that have the highest population. So that question may be answered by creating a matrix of what really is the service or product that you're bringing, and what are the biggest needs. Is it population? Is it government ease of adoption of innovation? Is it government ease of adoption of public-private partnerships? And all these are different country by country. And back to you, Abdul.
Thank you, Doctor. There's another question for you. It says, what is the main obstacle for rapid healthcare development? Is it financing, regulatory issues, specialized skills, medical professionals, or all the three?
As I showed earlier, thanks for the question. As I showed earlier, it's a very complex issue. It's actually the architecture of the economy to begin with. But I think that part of the problem is resources, is financial. That is very low. As I showed, the government puts in about $35, $50 per person per year, compared to over $4,000 in UAE. You're looking at $4,000 in Europe. So it's a small economy with a big population. That's number one. Number two is that the countries in Africa, though Africa is huge, 1.3 billion people, it's not easy to actually take advantage of that human resource, because they are all segmented in small countries that have different regulatory processes, different mobile networks, different this and that. So the big issue is actually finance, because we know that in many African countries, we have more trained nurses, more trained doctors than can be absorbed in that country. Yet, we have a shortage of health workers. If you look at most of these countries, and you look at WHO ratios for health workers, African countries are behind. Yet, when you look at the number of trained doctors and nurses in that country, they are more than can be. So the problem is absorption, which is a resource issue. That is a big problem. The next problem is obviously governance. That
كذلك أيضا مشكلة سنتعلق بالحوكة
where civil society and people are engaged, they are working together with the government, then that becomes a problem. And obviously, the other point to make is that Africa has many countries that are unstable conflict states. And in those states where there is instability, then you can't provide healthcare. So again, it's a multiplicity of factors, but the basis of it is financial resources that reduces the capacity of the government to absorb the health workers they need, yet they are trained. This is why you have nurses traveling to different countries. Kenya has entered an agreement with the UK to export. So you can see there, it's a resource issue at the base of it.
Thank you, Doctor. Dr. Ricky, I believe that your presentation was very interesting. I received a lot of questions, but let me start with the first. Dr. Ricky, there's the first question. The rapid test gives false negative results. Will there be other rapid tests more precise and which may cost less than PCR? It will reduce the burden on hospitals in Africa.
Right, thank you.
Thank you.
So I think for this question, it's a great question. However, as an engineer at heart, I can tell you that these does not exist. If this exists, then we don't have the pandemic in the first place, right? Every test has the strengths and weaknesses. Yes, PCR test is more expensive, require personnel, but then it's more accurate. Rapid test, yes, the performance in terms of accuracy is a little bit worse. However, it's the most affordable and also the most rapid solution. And I think if you look at the pandemic or the public health strategies against the pandemic, we have to look into a multi-pronged approach, meaning you need to combine multiple tools in your tool set in order to fight the pandemic. And this is exactly what we do here in Hong Kong, and we have able to provide a very strong working protocol that combine the rapid tests, which are affordable, but it's very fast, at the same time combined with the PCR test. And I understand in some developing countries that the resources are very limited. And I think the strategies would be adjusted. However, I think there are a lot of experts, medical experts in the area that have already mentioned how we can use some very affordable tests in order to control the fire. Yeah, we can't extinguish the fire immediately, but to stop the spread, slow down the spread, as we to buy time for the vaccination rate to go up. I think that's the key here. And again, there is no perfect answer here. I wish there is a perfect answer. And I wish we can be the one to invent the perfect answer.
Another question for you is how you can help in developing the health medical services in Middle East and in particular in Saudi Arabia. What is the best model that you can ask, that you can talk about, or you can advise them to do?
Right, I think this is all about collaboration. Just like any company trying to get into the Hong Kong or the Chinese market, or just like us that want to reach out to the local countries in the Middle East and Africa, it is all about business partnerships. And I think there are a lot of reasons why you want to work with company in Hong Kong, because the greatest strength of Hong Kong has always been the hub that able to logistically, politically, and professionally able to connect all pieces together, and as one of the key members here now in the Hong Kong ecosystem, I'm very happy to facilitate the discussion.
Another question, sir, is that what are the prerequisites to get partnership? What are the prerequisites to get partnership in the healthcare system from Dubai? Mr. Jaffar. Do you want me to repeat?
So, no, I heard the question. That's a little broad question. However, there are several requirements. It does fall under what the city is lacking in terms of what's currently available and what we're looking for. The volume or the recognizability of the healthcare operator that they're looking to come into partnership with us and so forth. Naturally, we're looking at renowned names in the market and certain healthcare activities or healthcare particular medicines in healthcare that we're looking for, example, oncology and so forth. So there are a few prerequisites depending on where we're sitting right now, depending on what the population requires.
The same question go to Dr. Gitahi. Do you want me to repeat the question, sir?
Could you kindly repeat the question, Abdul? Yes, thank you.
What are the prerequisites to get partnership in the healthcare system from Africa?
You know, I listened to Jaffar. It's similar, actually. I think the first thing to do is there are different partnerships, because in Africa, out of all the member states, we have public and private health services sitting side by side. And in many countries, it's almost half-half, service delivery by private sector versus public sector. And then, of course, there is a significant part of the private sector that is faith-based service delivery, that is driven by religious groups that drive service delivery, which is very supportive of the government efforts. So the first thing, if you look at the government, the prerequisite would be first to get your services or products passing through the regulatory system in each of the countries. The partnership with the Ministry of Health and whatever you may call the regulatory system, either the Pharmacy and Poisons Board or whatever other regulatory system, is a most important first step, because we've had products come into the country that miss these regulatory frameworks, and eventually there's a problem, and then the product or service is thrown out of the market, which you don't want. So the first thing is regulatory. The second is to identify whether you want to partner with the private sector or the public sector. If it is the public sector, we are now in many countries working on what we call Private-Public Partnership Act in each country. And these are going to make sure that the environment for partnership with the public sector is much better. Of course, to pay attention to the civil society, that if you want faster partnership, then the civil society, like ourselves and others, is an important trust broker for you to enter through, to say, okay, we want to bring this product or service to this country, which civil society is working in this area. We start to work together to kind of test the market, to pilot, then it becomes much easier for adoption by the community and by the government as well. So I would say those are the prerequisites that I would highlight right now. Thank you.
Thank you, Dr. Gitahi. Our last question will be to Ms. Alice. Ms. Alice, there's a question that is, how can Hong Kong encourage and help developing countries financially to develop their healthcare system?
I think the Hong Kong Stock Exchange market is a very good fundraising platform. So like the healthcare sectors in overseas can listed on Hong Kong Stock Exchange to raise fund, and there are actually many IPO listed for pre-revenue. So it is a chance a gateway for companies to seek fund via the Hong Kong financial market.
Thank you, Ms. Alice. Still, there are a lot of questions that were asked. I'm sorry, because the time is running fast, I cannot ask all the questions, but I promise our audience that I will send all the questions to the speakers, and we will try to get you the answers and share with them after the webinar. Thank you very much. The session, the Q&A session is done now. I would like to thank all the participants and speakers for making time to this insightful regional webinar. I strongly encourage you to consider attending the inaugural Asia Summit on Global Health, themed Shaping a Resilient and Sustainable Future, which will be held in hybrid mode on 24th of November 2022, offering both online and physical participation. Please do not miss this first of its time opportunity, as the main objective of HKTDC is to cement Hong Kong as a global investment and business hub riding on the Belt and Road Initiative and the Great Bay Area. Wish you all the very best and hope to meet you soon on 24th of November. Thank you very much.
Thank you.
Thank you.
Thank
Thank
you.
you.
Thank you.
Thank you, Abdulaziz. Thank you,
Thank
Dr.
you,
Lam.
sirs.
Thank you, all the speakers.